This is Dr. Katie Patel, and this is your Surgery Colleague Consult. Good morning, Chethan. So nice to speak with you. Would you mind just introducing yourself and what your role in the hospital is?
Yeah, absolutely. I'm a pediatric surgeon and I'm the trauma director at Cohen Children's Hospital here at Northwell Health. And I'm also the director for our Northwell Health Center for Gun Violence Prevention.
Wonderful. Thank you so much for taking the time to speak with me today. I wanted to get your advice for our medical students as they're thinking about how they can stand out and impress their surgery attendings, and also for those students that are interested in advocacy and gun violence prevention and campaign, how they can get involved with that before they even start residency. So could you tell me a little bit about your path to your current position?
Yeah, absolutely. It's been an interesting path. And for me, I started as a medical student in Toronto, Canada, where I'm from. And then I did my general surgery residency actually in Toronto as well. And prior to that, I was in Montreal for my undergraduate degree. So really, I was mostly in Canada up until about 6 years ago or so. And then I came to do my pediatric surgery training, fellowship at Northwestern in Chicago. And I really, as a medical student, I became enamored with surgery. I loved the idea of, being able to save a life right then and there, really making that impact to a family and a patient, in front of your face. And just the idea of operating and the actual anatomy and so on, it was just fascinating to me. So I really wanted to pick a specialty within surgery as well that allowed me to also honestly work on research and advocacy. And pediatrics really struck me because you really work at the intersection between surgery and pediatrics. There's a big global health component to that as well. And that's why I pursued pediatric surgery in Chicago. So I did 2 years of fellowship there, and then I came here to Northwell about 4 years ago to start my job as a pediatric surgeon. And when starting here, trauma was always part of what I did. My research was always focused on injured children. There's a big public health component to that, big advocacy component to that as well. And that was certainly a part of my career that I envisioned. I did not think that I'd be leading our systems approach to gun violence prevention. And this was an issue I was deeply passionate about. I had treated far too many kids, unfortunately, with bullet wounds in Chicago and in New York. And so I was tremendously passionate about wanting to tackle it. I just didn't think it was going to be a huge part of my career. But this is the way your life works, right? I got it in Northwell. I found out that Michael Dowling was taking a big stance on this topic, and I was fortunate enough to be given the opportunity to build out the center with him. And really, it's been a dream in many ways. So that in itself, that experience has taught me a lot about advocacy, policy, research, how you can make macro level impacts in addition to your career as a surgeon or a physician. And it's been a tremendous journey so far.
When you're working with third year or fourth year medical students who are rotating on their surgery clerkship, what can those students do to stand out and impress you as they're attending when they're working with you?
I honestly, I think the biggest thing is attitude. If you come in and you show that you're excited, motivated, that's probably most of it. It's not necessarily how much you know. Having said that, I mean, reading ahead of time, of course, and being knowledgeable, for example, in surgery of the case that you're coming into and knowing a little bit about it and being able to answer questions will absolutely impress people 100%. But there's something that differentiates certain students from others, and that's really this attitude, right? If you have a good attitude, you want to work hard, you say, hey, I'm here to help. How can I get involved? And you're showing that motivation to want to get involved and wanting to help, that is honestly the biggest thing. The other thing is sometimes medical students, don't be I think, overzealous with questions. Sometimes you're in a critical part of the operation and they're asking you a question that's hilarious. But you have major thing in front of you, just know the right place and right time.
Definitely. Tact is key.
Yes.
Let's say that a medical student is excited, they're involved, they want to be able to show you that they're enthusiastic and they're a part of the team. So they see your caseload and they say, oh, you have this procedure happening. I want to prepare for it. I remember when I was in medical school, we all rushed to open up our surgical recall books. Do you have any resources that you recommend or would be impressed that a medical student was using?
Yeah, great question. I mean, honestly, nowadays there are so many resources out there, right? Even
Mhm.
Google, up to
Yeah.
date, yeah, recall, ChatGPT. You can literally be equipped to know certain things. So I would say that it's not so much about the resource for me.
Mhm.
It's about just understanding at a basic level what we're trying to do and some of the nuances around the condition. And I think that's what really shows interest, right? If you've read a little bit about the case that you're going to be undertaking, that just inherently is going to show, oh, this person is interested. They're even if they don't want to do surgery, they're here to learn, they have the right attitude. And I will tell you, many students that impress us are not the ones that want to do surgery, right? You don't have to want to do surgery. It's more of this, you know, excitement and are you really interested to be there kind of.
Yeah, definitely. So for those students that want to go into surgery or the students that don't want to into surgery, what do you think surgery teaches medical students that you wish every doctor knew?
I think surgery really teaches you to make decisions quickly and that you can't have everything perfect. You can't have all the information, but you need to be able to make decisions with the best information that you have very quickly. And that's inherently what surgery is, right? Whether it be steps of a procedure as you encounter something unexpected, or whether it be treating a patient in the trauma bay, right?
Now, let's say that there's a medical student who knows that they are passionate about something in the advocacy realm. Let's say that it is gun violence and gun violence prevention, but they really don't know where to start. They might be early on in their medical school career, or they're trying to balance how to even learn how to put their gloves on in the operating room for the first time. How do they approach you or your team or someone in a similar position in order to get some advocacy experience?
Yeah, it's a great question. I mean, honestly, it starts by talking to your mentors, right, who might know someone. So I would say, what area of advocacy are you interested in? Are you talking about children's health? Are you talking about adult health, geriatric health? A particular field. Narrow that down a little bit, and then find the players that you think are inspiring to you. And don't think small. It doesn't have to be within the system. It could be anywhere in the world. If you use LinkedIn or social media, you could message anybody, and you'll be
Mhm.
shocked when people apply to you. So find those mentors, find those inspiration folks, and try to reach out to them, whether it be through leveraging your existing network or just looking in your system. I mean, at Northwell, for example, we have people doing amazing stuff across the entire system.
Mhm.
When I started here, it just took Googling and looking for me to find the right people to align with who taught me certain things. And so, first and foremost, I would say that that power is at your fingertips. There's a lot in the advocacy space you don't need to learn. It's just inherent to you, and you just need to get out there and start doing it. And that means if
Mhm.
you're passionate about an issue with the medical student, don't underestimate your voice already.
Mhm.
Right, there are a number of medical student-led organizations, associations that do great work in the advocacy space. Get involved with them, or start your own campaigns. And this could literally be you talking to other medical students across the country on a particular topic, learning about policy, diving in, reading. Those are all ways that very legitimately major movements have started before. And then once you find that mentor, like let's say you do go that path of mentor, it's working with someone like me, you know, just approach that person, ask and ask to shadow and see what they do. Advocacy is interesting. There's so many ways to do it. A big part of
Mhm.
my journey has been storytelling, journalism. I trained as a journalist, so I do a lot of writing. On the politics side, we work with a lot of government lawmakers, sorry, on the gun violence side. There are tons of opportunities for that. You can intern as well, more on the government side if you want to learn that aspect of health policy, that could turn to advocacy. So there's just so many opportunities. Um, and just you see really the young generation starting incredible campaigns on social media, um, through crowdsourcing. So it's really limitless.
Thank you so much for meeting with me. I really appreciate it. I know that the medical students are probably itching to hear what our attending surgeons are thinking. So thank you so much. I really appreciate it.
Awesome. Thank you, Katie.